And also I do speech test as well, so ask the patient to count, for example, from 80 to 70. And also you can do the swallowing test, and sometimes I do the Brack's test. I ask the patient to go to an ICP and go backwards and ICP, backwards and ICP. You don't see a lot of changes there, only when you put the occlusal contacts, you can see the slight changes in occlusal contacts, and you can see where there is occlusion control. It's very good to do when you do the restorations. You put them on, and you want to check your restorations, how they can sustain this retrusion control, especially if you change the position of the lower jaw. And teeth has to be prepared to prevent the lower jaw go backwards. Так, Жень, для тебя все готово? So, and the speech test, for example, is very good to see the mandibular lateral shift, if the patient has it or not. So it's just some kind of proof as well. От регистратора. You need opening or protrusion also from your mobile.
I can have as many as I want.
No, but you need everything, yes, right now.
I mean, I want that everybody see what happened when you import the models with one bite and you apply the other trajectories as
Он хочет тогда все траектории.
Ну, именно от байта, да?
But the
От его
models,
байта, да, от
the
его
models
байта.
need to come into the bite.
And here is with Panayotis. No. We had 3 position diagnostics. I don't remember what we used actually. Alkis, do you remember what we used for position diagnostics?
What?
What we used for position diagnostics in case of Panayotis? You can see here. So, for example, this is first position, ICP. I think it was, I don't remember what it was. It was, there is a doctor in Germany, Jürgen Malmann, something like that. He uses a phonetic test for bite registration. So he asked the patient to talk with special sounds, and he put the bite registration material, and he is waiting until the material sets and patients start to say 77, 77, 77. It's not precise, but when you don't have anything around you just to show the difference, you can use it. So we use it as a second position, and I don't remember what was the third position actually. But this is, I guess it was walks, but it was two soft walks. So it was not very real. So this is a position which is called phonetic position. And maybe it's close to the freeway space, I don't know, because there is one doctor...
It's retruded.
It's too retruded, yes. Or maybe it's what with the vox. If it's retruded, it's with the vox. And if we see the speech position, yeah, this is, I think this is a speech position that we used later.
We can apply those trajectories also if you support it.
These are all trajectories, but if you want them, yes.
I mean, it's to brainstorm this. I'm still learning for the process, so that's why I have questions about a few things.
Just have a look, guys, that the registration I did in July or June, I think it was phonetic test, but have a look where the first contacts are when I close the model. The same molar on the right side. And we can check another, this position. Look, so today and in June, we managed to find this premature contact in different position diagnostics tests. But this position, I agree, it's too retruded. Okay, well, I don't want to spoil Eugene's explanation about how to upload the CBCT, but I want to show you something. Well, to fill in the pause. Let's try to understand the trajectories. So once again, when you open the diagnostics, you see that the eye here of the axiography is inactive. But actually all the axiography is on the screen. So if you put it 2 times, it will disappear from the screen. And then you can open it and use whatever you want. So I'm really curious what you would tell me about this patient. You see, I do a lot of movements, and it's not very good for diagnostics. We have to separate one movement that we want to analyze. So I do open
Yeah,
it.
but you can shorten it.
Yeah, I can shorten the range. So here on the upper part of this slider, there is a range. So you can shorten the range you want to analyze. For example, let's do the first. So, and we can see, for example, you already know what yellow and blue tracks means for the condyle. So
I don't remember.
the right one is yellow, the left one is blue. It's condyle path trajectories.
Yeah, okay.
So let's see, here is, he's opening his mouth. And you can see here.
You have another trajectory system.
Yeah, it's strange.
I'm glad it happens. It happens to me too.
Жень, смотри, открывай 2D вид. У меня все тут траектории, хотя выделил только одну.
Не, ну у тебя то, что в комплексе нет, то есть ты закрой вот эту аксиографию, глазик закрой.
Так я...
Oh, you need to
Когда я
minimize
закрыл
all of
ее.
them for
Еще раз.
Еще раз закрыть?
И ударение.
Нет, смотри.
Вот. И значит, еще дальше делал аксиографию.
Сейчас. Нет.
А комплексную закрой.
Okay.
That happens to me.
The developer, good.
I'm glad it happens.
Yeah, it happens with me too, yes.